All right, Dr. Emmer, you're live.
Hey guys, it's Dr. Emmer, and we're here doing one of my favorite treatments. We don't actually post this a lot because we do it so frequently that I tell my social media team, you don't need to film that all the time, but we're doing a training tonight on a product called Sculptra. This is one of my favorite products. What do I call it? I call it the snow globe filler. Why do I call it that? Because inside, if you take a look, there's all these little particles. It's like snowflakes in a snow globe. And these particles go into the skin like fertilizer and build collagen. These are actually made of a suture material, like you stitch the skin closed with. But internally, when you put it into the skin, it develops collagen. In the old days, we actually used to mix it with much less fluid, and people get lumps and bumps, some that you could feel but not see. So now we mix it with a lot more fluid, and that allows you to treat a large area and just get lifting and rejuvenation. And one special thing that you get is what's called the Sculptra Glow. I know we like to call it the Emmer Glow, but some of it is with the Sculptra. And the Sculptra itself acts like fertilizer. So remember, if you fertilize grass, the grass is more green, it's more lush. That's what the skin will look like. So she's not only going to get a benefit in collagen production and lifting, she's also going to get better skin.
Yay.
And that's going to be great, right? So again, in the old days too, we used to use this just for volume. But what I want to do for her, she doesn't need volume. She just needs overall anti-aging. We want to lift this area up. We want to give this support around the mouth because the mouth tends to collapse as we get a little older. Jawline definition and lifting in her brow. So those are the areas we're going to focus today. We're going to use the Sculptra first. So weird feeling, 1, 2, 3, pinch into the temple. I always tell people this is kind of a weird feeling because it's on bone. You can actually hear this a little bit. But we just do a little pinch right there, and that's going to build collagen and lift that area over time. Lift your chin up a little bit. I'm going to go along the jawline here, just a teeny bit into the 90-degree angle, and just do a little thread, and then again, another little thread up more laterally, so that over time this will pull back and give her some more definition. So far, no bleeding, which is great. Sculptra actually does have a larger needle and tends to burn a little bit, so she's doing really good. I find the girls do this really well. We're also going to go down to the deep medial fat pad of the cheek, and we're just going to give it a little volume, just a little bit, onto the cheek fat pad, and then we're going to come out and do a little bit onto the bone. And that is going to allow us to kind of give some lift here. Now remember, this isn't a filler. This stimulates collagen, so it's called a biostimulatory injectable. And so it looks like there's a lot here, but there's actually not. It's just the fluid. We're going to do a little on her fold and go into the deeper part around the nose. That's going to allow us to get some support in her fold. Yeah, it's not the best, but I'm going to do this so it doesn't feel so bad. Before all those vibration hand pieces, this is what I did. It still works. And then lastly on this side, we're going to go right onto the bone around this area here and give some support. So typically we go onto the bone here for a little thread, along. Every so often we'll get a little clog, that's okay, there we go. And then we're gonna come across. Good, and just give it a little support. And just do massage. Now we're gonna go to the other side, we'll switch. You doing okay? Mm-hmm. Okay, it's gonna feel weird because there's numbing inside. Little pinch in the temple. And I always tell people in the temple area, you may hear it when it's going in, and you may feel a little bit of pain when you chew the next day, because you went down all the way to bone through the muscle chewing. You see her jawline here. So we're just gonna go a little bit into that 90-degree angle, very small thread, and then we're gonna come back. If she was a little older, and a lot more looseness, we actually could do threads all through here and build this up. We can still do a little bit of it. We'll see how much we have left when we get the main areas. She's doing great. And the goal is to look at this in a few months. And I always tell people, depending on your age, is how many vials you would need if you have low volume in the first year. So let's say you're 20 or 30, you might need 2 or 3 vials the first year to build volume, but we're doing this cosmetically. So we don't want to build a lot of volume. So she might not need more than this year. We'll see. Are you saying anything there yet, Jordan?
No.
switch from to do the both? Did you go from the one and then share to the other? No?
No, I'm like,
Oh, that's what I wanna do. That's what we need to do.
I thought we said just YouTube.
Huh?
I thought we said just YouTube on this one.
Oh, okay, I thought you were gonna go live.
Next one's
No
we're
worries, okay,
gonna go 2 angles.
okay, good. How many more do I have? These
One
two?
more, yes.
Okay, that's what I thought, give me another gauze. Perfect, we keep looking up. You're almost done, I promise.
We're gonna do 2?
No, it's not a number, 2 more, yeah, 2 more little vowels, but it's not really a number per se. Okay, there's the other side. Do a little more temple. I'm gonna go a little higher here on the brow, I wanna get her a little more lift on the brow. You can even go up into the hairline, all the way back, and get this to pull upward over time, almost like a thread. So now we do threads. So we do threads instead. I'm gonna come back a little further laterally for her cheek. Thank you. Move up a little higher. And then we're gonna go a little bit more laterally here, and just a little bit. Perfect. Massage there. Switch.
And the lip. This side.
Which one?
That lip.
The corners?
Yeah, because you did here.
Oh, no, the folds. I did it over there. I did it on both. Yeah, I did it on both. You probably just didn't feel it.
Oh.
Look up a little bit. There you go. See, we created a little bit more in the 90-degree angle. So we're gonna follow a little bit just along the jawline itself. And then we already did her folds. We already did in her chin area. And then what I wanna do, this was the deeper medial fat pad, but I wanna go here and come out laterally along her cheekbone. Just so we get some level of lifting there. So that is the treatments for sort of hand facial Sculptra. The issue with it now is you're gonna look like you have all this volume, but you don't, it's the fluid. That will all settle. So what she's gonna have to do is sort of massage these areas through here, along here and here over the next few days. And then in about 6 weeks, she'll really start to see some lifting and some rejuvenation to the face and the skin. So take care, guys. Perfect. I'll do this one.